Then comes Swastha. Who is Swastha? Health. What is health? It is very important to understand for us this. The definition of health in Ayurveda is very comprehensive, apt, though defined about 5,000 years. Samadosha, equilibrium of doshas. Sama Agni, Agni should be good condition. Samadhatu, Malakriyaha, all the dhatu should be in a respective form with the carrying functions. Mala also should be in a respective way of clearing it out, whatever the action it has to do. Prasannatmendriya, pleasant. You should be happier status, satisfied status. Atma, soul. Atma also should be in a happy status. Once dosha, dhatu, malas, prasannatma is there, and indriya, sensory organs also are in a good active conditions, with a good mind, we can see a sound health. Samadosha samadnischa, samadhatu malakriyaha, prasannatmendriya manaha, swastaha. Shushruta. He is the one who states about it. Whole body concept we can see here in Swastha person. If any one goes wrong, everything goes wrong. We cannot come back for normal maintenance. This is Swastha, what we call it. As we told about whatever dosha quality we are, that is fine. But the action on dhatus, or on mala, or on indriyas, or on our mana should be maintained to be happy, prasannata. Then the Atma residing in the Sharira or a Deha will be happy. Then the person who is having a happier Atma is Swastha. In whichever direction he had to go in, Swastha comes there. This Swastha we will be covering in little detail. So what is then Roga? We are reading about Swastha, fine. Then what is Roga? Rujyati iti rogaha. Whichever causes pain, let it be physically or mentally, that is known as Roga. Or dis-ease, what we say according to modern science, is dis, which is not comfortable. You are not happier. That is known as a disease. There are many more synonyms for disease also we say into amaya. This is called ama, undigested material, which is left into our system, is known as ama. We have already spoken about it. So amaya, where ama is already present in the body or settled in the body, whether it be physically or mentally. Any depression in the mind also is not an healthy condition. Even if I am angry, is not. Jealousy is not so. So this is also known as Roga. If it is seen in Rasavaha Dotash, it causes its own diseases. If it is seen in the blood, ama, there is unwanted products or unwanted chemicals, excess way or less way, that also causes your disease. So, Rujyati iti rogaha. Let it be heaviness, excess heaviness is not a healthier one. That itself also is a roga here. The aspects when we come into are various methods of classification of diseases. Innumerable are there. But for our study purpose in Ayurveda, we give importance for this major 6 ones. One is Nija. Nija means the disease is formed by itself because of our ahara or our quality of life, intrinsic. We have caused by our own negligence or our own habits, bad habits. Opposite to that is Agantuja, extrinsic, which has come from outside, epidemic ones. Rija and Agantuja. Second one is Sharirika, physical wise. And Manasika, mental wise. In Sharirika, we can say fever or any wounds or any kamala, whatever the disease we name it for physical body, it can be. In Manasika, dukkha, then pralepa, that is blurring out. Manasika, psychological problems like unmada, all those things comes into. This is all the disease-wise. When it comes the treatment aspect also, we have a classification. Sadhya and asadhya. Oh, this case is that we can cure it in a very easy way or simple medication way or just following the rules and regimens. Sadhya. Asadhya is incurable. We say, whatever we do, we cannot cure that condition. It's fixed ones. It's a deep-seated ones. There's sadhya and asadhya. Further, sadhya, what we told is a curable, it is divided into 2 ways. Sukha sadhya, easily curable, and kashta sadhya. It is curable, but with difficulty. It takes long time, or it takes longer duration of medications with diet, with other regimens to be followed. We do specify some majorly in some chronic cases like sadhya, sukha sadhya. Just in simple fevers, langanam paramaushadam we say. Do upvasa. Fever is gone. It's just a sign, a symptom, what is seen for a shorter period. Or ama, very mild ama. Just upvasa, don't put any food into the mouth. Don't eat anything. The indigestion, whatever is a smaller quantity, will clear up and you're fine. Kashta sadhya. It's difficult here. Already a fever has been affected with other infections. Cold, cough. At that condition, upvasa it does clears the fever because of ama originated. Even ama can cause you cold and cough also because kapha is retained in your lungs. There, we do require warm water, ushna jala, to cleanse it out. Or some of the medications to completely throw out the infective part from the system, which is already a long-standing one. Infective fevers we can take. It's a kashta sadhya. It is sadhya, but kashta. You have to take a longer duration of medications with the other medications like. Fifth one is asadhya. Asadhya is further classified as asadhya and yapya. Asadhya is incurable. You cannot cure it at all. Ayurveda, people may have an idea. You can cure all the diseases. No. When he does mention few are asadhya for our treatment aspects. If it is already astigata or shukragata wise, it's not possible, he says. Yapya, manageable with treatments, and withdrawal, those medication triggers. Example here he gives our tamaka shwasa, asthma, what we call it too. He says seasonal wise there will be a changes seen in them. Depending on the age aspect we are taking it. Yeah, we have medications. Keep taking a medication. If the medicine is stopped, some person is having a asthma, tamaka shwasa, which will trigger in cold season. He has to take care. He has to keep himself warm, not to have any cold food habits, not of unctuous oily foods, not much of sweets, which is kapha vruddhikara. If this all is followed, tamaka shwasa is under control. Otherwise, it may trigger. We know a person is having a tamaka shwasa, that is asthma. In a cold season, it aggravates for him. Because of his bad habits, he goes and eats ice cream. Or fridge water he drinks. Definitely, tamaka shwasa triggers here. If at all, if we have taking in a normal habits wise, in the winter, if we used to take a warm water and less of sweets or no sweets, no fried ones, his tamaka shwasa would have been under control. People do come and tell us, I can easily manage my breathing asthma in summer, but in distant place it is not possible. Dust triggers me. Means that has to be stopped or arrested or avoided. Then it is manageable with the treatments. It all triggers. This is yapya. Even diabetes, what we say, prameha and madhumeha we divide into. Prameha has early onset of diabetes. Madhumeha is full-fledged diabetes. Already it has become dhatugata. That is asadhya, he says. Whether a person may go into visionary problems or gangrene formation with any small wound or something, or kledatva, weakness in the system, that is known as asadhya, incurable, he says. If it is madhumeha, final diabetes, what we say into in asadhya. So asadhya is divided into asadhya and yapya. Sixth one is koshtashrita, confined to GIT. Here also we have divided into shakashrita, is confined to the skin. One is only confined to the GIT, one is only confined to the skin, shaka. Shaka is external, skin part. In that, koshta shakashrita, with the signs and symptoms are seen in the GIT, gastrointestinal tract, internal organs, and also the skin, outside tissues also. Koshta, there is GIT, shaka is external organs, ashrita, placed or settled. So, Roga is being divided here into Nija and Agantuja, one, Sharirika and Manasika, that is physical and mental, Sadhya and Asadhya, curable and incurable. Sadhya is further subclassified as Sukhasadhya and Kashtasadhya. Asadhya is further classified as Asadhya and Yapya. Another one, final sixth one is Koshtashrita, Shakashrita and Koshta Shakashrita. Depending on this way, we can treat. Koshtashrita is GIT, we can treat only Koshta. gastrointestinal tract. It will be clear. Shakashrita, here when treating, local applications can be done and it will be clear. By chance, if it is from the system gone to outer extended, that is Koshta, which is Shakashrita, the treatment has to be done from both aspects. Koshta also should be cleared, outside structures also has to be cleared, Shaka. Then only the disease can be treated completely. If at all, in Shakashrita, if we can give internally or external part, whatever the skin concerned to can be cleared. There, GIT is not necessary to be taken care. In Koshta, only GIT can be treated. Otherwise, in Koshta Shakashrita, both has to be taken care. Otherwise, it becomes reoccurrence of the disease. You have not cleared GIT, you are giving only external application. Some skin problem issue has come, you are just giving a lay optional application or outside oil or ointment or whatever you are external, you are doing it. Till you apply the medication, it works. But the cause is even in GIT. That also causes a triggering point there. If you don't clear the GIT, the external part also, Shaka also is not clear. So, Koshta Shakashrita. Hence, in Ayurveda, when we diagnose a disease, we should know these factors. Whether it is a Nija or Agantuja or Koshta or Koshta Ashrita. Otherwise, we fail in the treatment. If that is the case, in doshas, where all it can be, you can see in dhatus. As I explained earlier in Malas also, there is a Vriddhi Lakshana and Kshaya Lakshana. Same way in Sapta Dhatus also we can see Vriddhi and Kshaya Lakshanas. In Rasa Dhatu, Praseka, water brush, people tell, whenever I open my mouth, there will be a saliva completely drooping out. Water brush we can see. Alasya. It's a Vriddhi, heavy. Rasa exactly is so heavy in the nature in his body. It's a lethargy it causes. Gaurava, heaviness it is caused. Svatya. Shvaitya, it is pallor. Shaitya is cold. Shva is pale, white. Shaitya is cold. Shaitya we can call. Shlatangata, worn out feeling. Because it is so heavy and lethargy is there, you feel like just keeping in one corner. Swasa kasa, respiratory problems. Swasa is difficulty in breathing, kasa is cough. Atinidrata, because heaviness is there. Korva. So they will have an increased sleep in him. If rasa is kshaya, reduced, shrama, easily he gets fatigued. Shosha, he'll be emaciated. Glani, dizziness he can feel because of the weakness. Shabda sahishnuta, Shabda asahishnuta, intolerance to loud sound. Rudratva, palpitation. Person to come and tell us, sir, I can't hear extra sounds. I get irritated. And my heart starts beating very fast. Once the person comes and tells this is nothing but rasa Lakshanas, we should immediately catch the cases wise. Rakta. Vriddhi Lakshana is Visarpa, herpes we say. Vidradi, abscess formation is there. Kushta, skin disease can happen. Because it's Rakta, it travels all the way. That's why. Pittasra, bleeding diseases. Gulma, abdominal tumor. Anyway, the secretion can happen and forms into abscess or in a tumors. Sammoha, person goes to coma. Venga, disorders patches on the faces. We can Rakta, Vriddhi Lakshana is there. If at all Rakta is Kshaya, Amla Shishira Preeti, desire for sour, cold foods. People come and tell us, whenever I feel like I love to have sour food, but it should be cold. Shira Shaitilya. Shaitilya, looseness. Where? Sira, blood. Rukshata, dryness of the skin we can see. Pandutha, roughness. Suptata, cracks we can see because blood circulation is not there. Then comes our Mamsa, Vruddhi Lakshana. Gandha, cervical lymphadenitis we can see. Granthi, tumors. Increase in cheeks, thighs and abdomen we can see. Overgrowth of muscles of the neck and other places also we can see. Mamsa is increased there. It has to grow more. Heaviness is to build up. So where we can see? In the muscles. Kshaya Lakshanas. Kshinata, wasting we can see. Cramps. Rukshata, dryness we can see. Katakatayana, crackling sounds in joints. He knew that time itself, or Ayurvedic Rishis. Katakatayana, crackling sounds, muscles. They are rubbing one to one. That's the reason Katakatayana we can see. In Medas, adipose tissue, when we come into Vruddhi Lakshanas, fatigue. Adipose is actually heaviness it causes. Difficulty in breathing. Because the fat accumulation is so excess, any movement is not possible much. With little work, he feels tired. Drooping of buttocks, excess fat accumulation, that's why. It starts because of a gravitational force and heaviness of the earth Mahabhuta. It starts sagging down, breast and abdomen. If at all it is Kshaya, Shinata, wasting we can see. Icha for Mamsa, because Medas is fed by Mamsa. Dhatu Poshana Karma. Mamsa is there. And Snigdha, unctuousness it requires. Dravyas, reserve for fat and meat. Directly they ask him. Next comes Asti. Excess is overgrowth of bones and extra teeth we can see. Shaya, Sandhivata, osteoporosis, rickets. Shaya Lakshana you can see. Majja, bone marrow. Heaviness of the eyes, body. You can see increases of the size of joints, which causes ulcers and difficulty to cure, we see. Not much can be worked here. Kshaya Lakshanas, Brahma, giddiness. Shitilya, Shitilya, debility, delusion, demyelination. This cannot be treated much exactly because it is already in a Majja Dhatus. Kshaya Lakshanas, you can observe there. Next comes Shukra Dhatu. Vruddhi, high sexual desire. Seminal calculi also formation can happen because it's so concentrated in them. Vruddhi Lakshanas. In Kshaya Lakshanas, Shandatva he says, impotency, Vandyatva, infertility. See, Shandatva is different. Vandyatva is different. Then Durbala, because Shukra is final nourishment, final nutrient to our dhatus, nourishments. So if this is seen, definitely he'll be Durbala, weak. This is the major Vruddhi and Kshaya Lakshanas of a person, what we can go through into.